Hello, I'm Dr. Elliott Antman, a cardiologist at the Brigham Women's Hospital in Boston, Massachusetts. I'm a past president of the American Heart Association. I was president from 2014 to 2015. In its nearly 100 years of existence, the American Heart Association has been grounded in the very best science in the cardiovascular world. It supports that science by offering research grants and conducting scientific meetings. This is a very important time of year for the American Heart Association because we have our largest meeting called Scientific Sessions, where many different topics are discussed, new data are presented. And some of these new data that we look at are from late-breaking science sessions. I'm particularly excited because this weekend we are scheduled to have scientific sessions for the American Heart Association, and there's some new information about management of high blood pressure, also known as hypertension. Some of you may know that many years ago, we considered a systolic blood pressure, the top number, of 140 millimeters of mercury to be normal. Subsequently, it was recognized that that was actually too high, and the normal value was reset to a lower range of 130 millimeters of mercury. And within just the last few years, it was determined that even that was higher than is desirable. And the new recommended value is to try and obtain a systolic blood pressure of less than 120 millimeters of mercury. It is estimated that with that new value, about half of American adults would be considered to have high blood pressure. And this is a complex problem because the presence of high blood pressure in a given individual is related not only to the medications that they may be taking, but their own personal behaviors and lifestyle, as well as where they live and work and the social determinants of health. So I am very interested in information about how we can do a better job in controlling a person's blood pressure. And there are several interesting papers that will be presented at scientific sessions. Some of them deal with new digital tools, such as a blood pressure cuff that you can use at home, and it has Bluetooth, which communicates with your smartphone, and your healthcare provider can actually see that in your electronic health record. We also have a variety of new ways of evaluating and delivering care for patients with high blood pressure. Some of the studies that have evaluated those new techniques are from within the United States, and some are from other countries. Thus, new ways of healthcare providers offering evaluation and management possibilities for hypertension outside of the hospital, outside of the clinic, and outside of a doctor's office. From what we know so far, these new digital tools and these new techniques for managing hypertension outside of the hospital or clinic setting have been very successful. So my advice to you is know your numbers, know your blood pressure, and that's one very critical part of putting yourself on the path to ideal cardiovascular health. Thank you for listening.